أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. And welcome to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. My name is Najwa Mohammed Luddy and we're coming to you live from Cape Town, the ITV studios in beautiful Mother City, Cape Town this evening, inshallah. Thank you so much for tuning to your channel 347 for this wonderful, wonderful program. Tonight we have once again another IMA member as my guest in studio, and her name is Professor Amenah Shaikh. Assalamu alaikum wa rahmatullahi wa barakatuh, Doctor.
Wa alaikum salam wa rahmatullahi wa
Jazakallah so much for being here.
It's my pleasure. Thanks for inviting me.
It's only
Najwa.
a pleasure. Shukran so much, Doctor. And to all our wonderful, wonderful viewers, doctors and orthodontists in private practice in Cape Town. And this evening we're having a very, very interesting topic of discussion. We're basically going to talk about orthodontic treatment. And the specialist is with us, inshallah. She will be giving us much more information how to get that pearly white smiles, inshallah. But before we do that, let's start off with a tarbiyah of tonight's program, inshallah. Bismillahir Rahmanir Rahim. Tirmidhi reported the following: 4 things are from the practices of the prophets: the feeling of modesty, chastity, scent, cleaning the teeth, and marriage. It is a known fact that the Messenger of Allah sallallahu alaihi wasallam used to use miswak regularly to clean his teeth, and not just pertaining to wudu or to salah. He especially used to be careful at cleaning his teeth before reading the Holy Quran. The purpose at using miswak is cleaning the mouth, and the general purpose is pointing to the following hadith: use miswak. Certainly, miswak is a cleaning for the mouth, as narrated by Bukhari. It is narrated that the Prophet ﷺ did not used to go to bed without taking his miswak with him, and when he got up in the morning, the first thing he used to do was clean his teeth, as narrated by Abu Dawood. Some companions told they could not count how many times the Prophet ﷺ used to clean his teeth with miswak in one day, as narrated by Ahmad bin Hanbal. Aisha radiallahu anha related that the Messenger of Allah stated the following: the merit of the salah performed after using miswak is 70 times of the salah performed without using miswak, as narrated by Ahmad. In another hadith, the attention is attracted to cleaning the teeth before salah as follows: if it would not be difficulty for my ummah, my community, I would order them to use miswak before every salah, as narrated by Bukhari. Islam scholars indicate that the cleaning of the teeth is mustahab, that is recommended in 5 situations, which are as follows: firstly, when the teeth becomes yellow; secondly, when the smell of the mouth changes; thirdly, when someone wakes up; fourthly, when someone stands up to make salah; and lastly, when doing the wudu. Some scholars also feel that the cleaning of teeth should be done before reading the Noble Quran and going into public spaces where interaction with society is anticipated. Sadaqallahul Azim. Mashallah, every week we have the most beautiful tarbiyah that is really linked to our topic of discussion. As this evening, we'll be talking about orthodontic treatments with the orthodontist live in studio, and the lines are immediately open for you to be part of this program, inshallah, anything relating to orthodontic treatments. But before we start, I just want to read out the weekly activities of the Islamic Medical Association, and this week, inshallah, we'll be concentrating on the renal dialysis appeal. The Islamic Medical Association is a national non-profit organization that has been in existence for over 30 years. It has numerous projects under its banner, and the renal dialysis project was launched in Durban. That was in November 2007, so it's about 8 years ago. In Gauteng, it was in October 2011, so that was about 4 years ago, and in Cape Town, January 2014, so that's almost 2 years ago. The main purpose of this project is to provide funds to the underprivileged patients who do not have the financial means to continue their chronic dialysis treatment regimens. The renal dialysis is a means of survival for patients suffering with CKD, which is also known as chronic kidney disease. It is a very costly form of treatment, and the criteria governed by limited funding forces numerous patients to be excluded from the state program. Financial assistance is needed in the form of donations, which can comprise of lila or zakah, which is the monetary donations, as it is sorely needed for us to sustain the renal dialysis project. And you may contact the offices of the IMA, and the numbers do appear on your screens. The Cape Town number 021 762 1414, in Johannesburg 011 837 6717, and in Durban 031 207 2250. As I mentioned, the number do appears on your screen. Please try and support the renal dialysis appeal, inshallah, so that we can make a difference in the lives of so many. Well, now, Doctor, we can start our official program. Shukran so much also for your patience, inshallah. And I want to encourage all our viewers, please be part of this very interesting topic that we're having. We're discussing orthodontic treatment with the orthodontist, Dr. Amenah Shaikh. She's a professor. I think I asked you this last time on my radio. How do I need to approach? Must I say professor or doctor?
It really doesn't matter. Okay. It's Amenah.
It's Amenah. Okay, fine. Shukran, Amenah. Amenah, let me ask you the first question, inshallah. I think, you know, we as the viewers and the laymen, maybe you can just explain to us really, what is the role as an orthodontist in the discipline of the dentistry?
Okay, orthodontics is actually a speciality is one of the specialities in dentistry, and most people will know it as the person who does the braces. Yes, we do braces, we do straighten teeth, but it's not just about straightening teeth, because at the same time we're watching the growth and development of the child as they grow into adulthood. At the same time, we're looking at their growth patterns, we're looking at how their teeth come through, and eventually how they bite together.
Yes.
And how they look. Yes. I mean, the large majority of people that come for orthodontics is because they want to look good.
Yes.
So, yeah, in essence, that is, you know, it's from childhood to adulthood that we do play a role.
So there's a huge difference between a dentist and an orthodontist.
Yes, there is.
Okay.
It's a speciality, like you have the optometrists and the dermatologists.
Yes.
So we have different specialities. Orthodontics is one of the specialities. The other specialities would be like prosthodontics, maxillofacial surgery.
The prosthodontist, is that the person with the implants that specializes in the implants?
The prosthodontist is the one who restores the mouth where there's missing teeth, essentially, or badly broken down teeth.
Yes, yes, yes.
So they repair large problems, like, you know, missing teeth, and if they are badly broken down. So you're putting in implants and dentures and crowns and what people call caps on the teeth.
Yes, but your speciality is mostly where the braces is concerned, and those are those little, they call it draaitjies.
Yeah, exactly. Yeah, that is one of the ways in which we do it. In younger individuals, we use what lay people would say are plates.
Right.
They're removable appliances that we put in the mouth.
That's right.
So there's a range of ways in which we do treat, but obviously the 80 to 90% of the people that we are seeing, it's with what you describe as the wires and the tracks.
There you go. Well, to all our wonderful viewers, the lines are open immediately for you to be part of this interesting program, 0216960109. That's the number to dial and to speak directly to Professor Amenah Shaikh. She's live in studio, and we're discussing orthodontic treatments, anything that you would like to know. Because I know, Doctor, there's a whole lot of myths about it, you know, and inshallah, this is what we want to achieve at the end of our program, is just to inform and educate our viewers regarding this interesting topic, because I know anything is possible with the orthodontist, inshallah. Doctor, maybe you can also just explain to our viewers when is an appropriate time for a child really to be assessed for the possible need for orthodontics?
Okay, if we look at the development of the teeth and how the teeth come through, we could break it up into 3 stages. We look at the child when they have their baby teeth. Right. You may ask, why is it important that we look at baby teeth?
Baby teeth?
Yeah. Baby teeth are important because they basically keep spaces. They have a purpose. Yes, they do fall out, but they have a purpose in terms of how the teeth eventually come through when the permanent teeth come through. So yes, we're looking at the baby teeth, and we're also looking at how the baby teeth are in the mouth. For example, as the child grows, we know the teeth don't grow. Yes. The jaws grow. So as the baby teeth come through and the child matures to about age 5, 6, when they're getting ready for their permanent teeth, we should start seeing spaces between the teeth. And that is an indicator that everything is healthy and normal.
We've got a beautiful slide right on the television now.
The one that we have on the television is what we would most commonly see, where you know, most of our patients present when they have their full set of teeth and they're severely crowded. That's a severe case. But we start looking also earlier, you know, as the teeth come through, before this stage is reached. If you look at that slide, you'll see on the top left of us, right of the patient, the lateral incisor, that's the tooth behind the next to the center tooth. You can see that it's behind the bottom teeth.
That's right.
Now, had that child been seen earlier, that tooth would have been moved over. So we do what we call preventive treatment. And then the malocclusion or the problem is not presented in such a severe case.
Okay, all right. Shukran so much. And that is basically what we're calling the crowding of the teeth.
Of the teeth.
Okay. Shukran so much, Doctor. Very, very interesting. I think we're going to have an extremely interesting program here this evening. And the lines are open, 021-696-0109. Doctor, we need to go for our first ad break, inshallah. But to all our wonderful viewers, be part of this interesting program and call us directly here. But we will definitely be back with this program very, very shortly, inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and welcome back to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. With me is orthodontist Dr. Amenah Shaikh, and we're discussing orthodontic treatments here this evening, inshallah. The lines are open, 021-696-0109. Please make use of that and be part of this very interesting conversation. Doctor, before our break, inshallah, you mentioned about 3 stages, and you mentioned the first stage, which is really the baby stage or the primary stage. Can you maybe just explain to us the other stages, inshallah?
The next stage is quite a critical stage. We call that the mixed dentition stage. That is when the child starts shedding their baby teeth and the permanent teeth start coming through. Right. That is also a stage in which we play a role, because you could do what we call interceptor problem. So, for example, we know that the front teeth come out first, right? So as the front teeth start coming through, you're expecting to see that the top teeth will overlap the bottom teeth. That is one of the things that you look out for. And if that doesn't happen, then we can actually fix it early enough. Should we not fix it, then we're going to get what we saw in that slide.
And that's the crowding.
That is severe crowding and loads of problems. You can see the teeth are all over the place. So there are, at that particular instance, and this would be around the age between 7 and 9 years old. Obviously, we all grow at different rates and different times. We know parents will talk about teething. You know, some people start teething earlier, some kids start teething later, and that's why we have this wide range. And you can see the second stage there on the slide, the early mixed dentition stage. That is a critical stage for interceptive treatment. So things like that would be sorted out using plates. Predominantly plates.
All right. So it's very important for us really to take note of that, because often we think the baby teeth is automatically falling out after a while, but we need to take our kid, our children, to a specialist to basically see will it progress normally, and as doctor said, early intervention is key.
Is key. If I can just add, another thing that you should be looking out for at this stage is when they have double rows of teeth. How often don't we hear that, that my child has double rows of teeth, where the baby teeth are still in the mouth, when they should have fallen out, and the permanent tooth has come through. Now that is already disturbing the pattern of the teeth coming through. So there again, we should be removing, and there's an example, there are two examples. You'll see the top one with the baby teeth retained in the front, and you see the top permanent teeth have come out behind. Two things happen there. They don't look right, and they could have severe consequences as the other permanent teeth come through, but you can also see that those bottom teeth look long, so they being knocked against with the top teeth as the child bites. So those teeth can actually become loose and become loose, and one could lose those teeth unless we intervene early enough. So in that case, on the top where there's double rows of teeth, you would remove those baby teeth, fix those with a plate, so you'll get the top teeth over the bottom teeth, and then monitor. With the bottom one, you can see what has happened as a consequence of leaving a baby tooth. Now if you look at the slide, the bottom slide on the right hand side, that's the patient's left, you'll see next to the center tooth there's a little tooth there, that's a baby tooth that never did fall out. But see what it's done, it's disrupted the pattern of eruption on that entire segment, on the entire left side of the patient. It's been disrupted. And whereas if you look at the right side, everything is normal and healthy. Now had that tooth, that baby tooth, been removed, we would have prevented a problem. This child now needs braces to fix it. So you see, at that stage between 7 and 9, it's a critical time to check whether there's any intervention that is needed. Okay, fantastic, great slide. Doctor, there's a caller. Can we go to the lines? Let us go to the lines. Assalamu alaikum and welcome to the program.
Wa alaikum salam.
Wa alaikum salam. Please, doctors listening, you can pose your question.
My question is regarding wisdom teeth.
Yes.
I have been to the dentist earlier in my, early 30s, 35, and I was told that if your wisdom teeth doesn't trouble you, don't worry about it. And then you hear that you're supposed to remove your wisdom, when you're 25 years old. And all that confused me. And now, I'm really suffering with my wisdom teeth. Not pain, but it's pushing the other teeth, and the teeth next to it is rotten. But there's no pain at all, the wisdom teeth. But all three are troubling at the moment.
It sounds like your dentist had given you the correct advice, in that it wasn't really necessary to have those wisdom teeth removed unless there were a problem, or unless there were potentially a problem, and usually the dentist would assess that. It sounds more like your other teeth need attention. And I think for that you just basically need to see your dentist and seek the advice of the dentist as to what would be most appropriate in your case. So they would assess the teeth, where the pain's coming from, the rotten teeth, and obviously save whatever is restorable, which is savable, and I'm sure you would be able to be sorted out, inshallah.
So it's not true that you need to remove your wisdom at the age of 25, 30?
Wisdom teeth are usually only removed if they're problematic, or if they could potentially be problematic. The times when they are removed is sometimes they're half out of your mouth, or they cause infection in the mouth, they cause pain in the mouth, and it's direct. There's a direct relationship between the tooth, or the position of the tooth, and the pain that's coming through. That's when we take it out. There are people who have wisdom teeth that are healthy and normal and in the mouth, like all the other molars too. So it's not necessarily the case of all wisdom teeth must be removed.
Okay, jazakallah.
It's only a pleasure. Wa alaikum salam wa rahmatullahi ta'ala wa barakatuh. You're most welcome to call us. The lines are open, 0216960109 anything relating to orthodontic treatment. That is our topic here this evening with the orthodontist, Professor Amenah Shaikh, live in studio. Doctor, we had very interesting slides thus far, but maybe we should also, like you said, you basically specialize in braces. That's one of your specialities. What really are we looking out for considering the possibility of having braces?
In terms of?
In terms of what is the shape, what should be the shape or the condition of the teeth for us to really go for the braces. Looking at those two slides that we had, can we have braces for the bottom slide already that we saw?
Yes, we can.
Okay.
You'll see that the full permanent dentition, all the permanent teeth are in the mouth.
That's right.
In that particular case, for example, that baby tooth would be removed.
There you go.
Braces are then put on to align those teeth that are not aligned properly. Now remember, when we're treating a case like this, for example, that mouth or that particular set of teeth, the top teeth, have to be biting with the bottom teeth. You know, often we get asked the question as to why am I having braces on both the top and the bottom teeth when only this tooth on top is not right. But once you start moving teeth, you're actually disrupting the way you bite. So, you know, we have to put the braces in the mouth so that you can maintain a good stable bite and you can function normally too.
Yes. Doctor, that slide, the first slide that we just saw, the two with the baby teeth and you know, the permanent one, the bottom gums looks very red. Is that because of the pressure? Or is that a healthy gum? No, it's not a healthy gum. That is something I was alluding to earlier on.
That's right. Where you can see if the child is going to bite, those top teeth, the permanent teeth that are behind the bottom teeth, they're going to basically crash up against the bottom teeth, and that is actually a comfort bite that the patient goes into. So the teeth come together with the edges together, but the child can't bite because the back teeth are not meeting, so only the bottom jaw can move, so the bottom jaw will move forward. So every time the child bites, they are biting against those bottom teeth and pushing those bottom teeth forward. And remember, the bone in front of that bottom teeth is very thin. So you're basically loosening the teeth, and you can see the effect. You see the tooth being longer, so we're losing bone there, and the gum is going away from the tooth.
Wow, very, very interesting. Very, very interesting. So, doctor, as we started our program by asking, you know, why is baby teeth so important? Inshallah, I'm sure that is where it all starts, you know, for us to have a beautiful, healthy set of teeth, even right through your adulthood. But inshallah, we will be discussing and asking the professional orthodontist, Professor Amenah Shaikh, all these niggly questions, but we also want you to call us 021-696-0109 so that we can continue with this very interesting topic of discussion regarding orthodontic treatments. Another short ad break, inshallah, but stay with us. We'll be back shortly. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and welcome back to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. My name is Najwa Mohammed Luddy, but my guest is Professor Amenah Shaikh. She's an orthodontist in private practice in Cape Town. But this evening you can call up directly and speak to on 021-696-0109. Anything relating to orthodontic treatments. That is our discussion here, inshallah. Doctor, you mentioned that, you know, about braces. That is basically one of your specialities as well. Can I basically still have, I want to ask you, pose this question, can a person still have braces if you have lost maybe a number of your teeth already? Is that possible?
Yes, it is possible. When we're considering braces, obviously the teeth have moved or they're crooked and we're wanting to fix it. Before we start with braces...
Doctor, sorry, there's a caller. Can we just take that caller, please? Okay, let us go to the lines. Assalamu alaikum and welcome to the program.
Assalamu alaikum.
Wa alaikum salam, my dear.
I'd just like to ask Professor Shaikh, is there a maximum age that an adult can have braces?
Okay.
Oh, mashallah.
The question comes at exactly the same time that Najwa asked this question.
Are you going to listen on air or are you going to put that, then you can watch?
Okay, I'll listen on air.
All right. Jazakallah so much for that interesting question. Alhamdulillah.
Okay. I started off by saying that, you know, Obviously, the teeth would be crooked and you're seeking treatment, but you've lost teeth.
Yeah.
It's not to do with age, it's more to do with the health of the teeth.
Okay.
If the teeth are healthy, there's enough supporting bone, then you're okay for braces. So it's not about the age, it's about the condition of the teeth and the condition of the mouth.
Yes.
We can put braces in for anybody, any age.
Over 50, over 60?
I've had somebody who was 70 years old who's had braces and successfully treated.
Yeah.
The thing is, when people have lost their teeth already, it's usually adults, and teeth start drifting and they start becoming skew, although they may have had straight teeth, and they want to fill the gaps. But the dentist can't do justice to filling those gaps and keeping you looking good.
Right.
So often teeth have to be moved into a position where it makes it easier to fill those gaps with bridges and implants, etc., and give you a good aesthetic result as well. So yes, there is a place for anybody who has healthy teeth in
So
their
there's
mouth.
hope for everybody.
Absolutely.
There's definitely hope for everybody, to all our wonderful viewers, with this wonderful specialist, an IMA member, live in studio. She's an orthodontist, and we're discussing orthodontic surgery or treatments here this evening. Doctor, why do some people need braces as well as jaw surgery? Because I've heard of cases like that.
Yeah, now remember, teeth are in the mouth, which are in jaws, which is in a face.
Right.
And if we look at the face and the way the teeth are in the face, sometimes you'll find people who have prominent bottom jaws, or small bottom jaws, or prominent top jaws, and the teeth may be straight in the arches, but the bite is not right, or the face doesn't look balanced.
Right.
So the surgery is usually related to getting the jaws aligned so that the face is in harmony.
Yes, yes.
One of the classic examples, or the most common one, would be where you have a prominent bottom jaw, where teeth are straightened in their respective jaws, and then the maxillofacial surgeon will actually reposition that jaw to set it back so that there's a more balanced look of the individual, and also the bite then is okay. And that is the most common reason why we would need surgery. When we do surgery in those kind of cases, it has to be done when the individual is grown. So they've passed their growth. So it's looking at 18 plus. The surgeons are even saying now that the later you do it, the better. Because remember, once the surgery is done and growth happens, then you're actually going to have some relapse. Whereas if you wait for growth to happen almost complete, then you'll have a better result with jaw surgery.
You said so beautiful. The face must be in harmony. Mashallah, that sounds so beautiful. Really, alhamdulillah. So you people really, I mean, the orthodontists really see, you know, so that they can make people feel comfortable and proud also. And as Doctor said, often the jaw might not be aligned with the teeth, but you people are there to correct it. And Doctor, in terms of cases, are all cases successful, people that comes to you?
I would like to think so. Success depends largely on how the individual feels about themselves. Because if you look at beauty, beauty is in the eye of the beholder, we always say. So it's a very subjective thing. We are guided by norms. We are guided by things like harmony, balance. And that is what we aspire to when we are treating an individual. So, you know, if you visit an orthodontist, we would typically look in the mouth, we look at where the teeth are in your mouth, we look at the way you bite. Then we also take photographs, and there's purpose for that. We don't only take photographs of the teeth, but we also take photographs of the face in various angles. And that is to ensure that when we do move the teeth, we still give you a harmonious look and then enhance your facial profile, and not just straighten teeth in the mouth. So we're looking at the face as a whole.
A holistic approach, to beautiful pearly white teeth. The lines are open, 0216960109. Make use of that telephone line and speak directly to the orthodontist live in studio, and she will do her best, inshallah, you know, to satisfy that question of yours. Doctor, what is the treatment time really for braces? Because often you see somebody having that braces on for quite a length of time. Is that normal?
It is normal, yes.
Okay.
The treatment time on average, I'd say, would be 24 to 36 months.
Okay.
We often get asked the question, why so long?
Right.
Remember, we're moving teeth. Teeth are live objects in the mouth. Right. They're not objects that you could move like you're moving a chair or moving a piece of furniture.
Yeah.
They are in your mouth, in your jaw, with blood vessels and nerves, etc. So you're moving them gradually through the bone so as to be in a physiologic situation. If you're going to move them too quickly, you're going to damage the teeth, you're going to damage the bone underneath. So, you know, you're going to harm the teeth. So it has to be done in a very slow pace so that you keep the environment healthy.
Yes,
so it's like a very small fracture which allows to be healed, and so you go. So you move essentially 1 millimeter at a month.
Oh wow! So it's a very, very slow process.
And that's why it takes so long.
But patients, then eventually they will have that beautiful smile, inshallah. Doctor, there's a caller on the line. Let us go straight to the lines. Assalamu alaikum and welcome to the program. Assalamu alaikum and welcome. Unfortunately, we can't connect with that caller, but please try to reconnect with us on 02169601009 if you would like to speak directly to Professor Amenah Shaikh. She's an orthodontist, and our topic is orthodontic treatments here this evening. Doctor, the caller just came through. Let us go to the lines. Assalamu alaikum and welcome to the program.
Hello.
Oh, hello. Good evening.
Yes, I would just like to give my report on this teeth business and this implants.
Okay.
Hello, can you hear me?
We can hear you, sir. You can go ahead.
Okay. It's a total, let me tell you, waste of money, waste of time. I spent, if I must tell you exactly cent for cent, what I spent on my operation, 6-hour operation.
What are you talking about? Is it the implants, sir, or the braces?
The implants, yeah, the implants.
Okay, so we are basically talking about the braces here because doctor is an orthodontist. There's a difference, doctor, between the orthodontist and the person that does the implants. So doctor does not do the implants, sir. We're just talking about the braces now. That is basically doctor's speciality.
Yes, but it comes back to the same thing. From the orthodontist, you get sent out to do the implants, right? And it's a very costly exercise. After I've done my operation, let me tell you exactly 2007.
Yeah.
And it's now 2015. All the implants that was done, 8 of them from the top, has all fallen out. They've taken bone from my right leg to extend the top gum. It was just a total waste of money, and I can tell you right now, dear, with the greatest respect, it was well over 600,000 that I spent on that operation.
Okay. We're terribly sorry for that, sir, but doctor won't be able to really... Doctor, would you like to answer?
But you people that's got this program on air now today, have got to bring this to people's notices.
Okay. All right. Thank you so much. Thank you very much for that view to that gentleman. Doctor, maybe we can just explain a little bit again in terms of the orthodontists and where in the industry, you know, the discipline of dentistry do you people fall in?
Okay, like I said in the beginning, we move teeth, basically. We move teeth using braces and orthodontic appliances. If I can just respond to the gentleman.
Right.
What he went for was implants, which are, like you correctly said, is done by the prosthodontist.
Yeah.
I think you must always also understand that like orthodontics is a speciality, prosthodontics is also a speciality. And one must be careful when you go and do specialized work because there are, you know, general practitioners who also do implants and they also do orthodontics in their practices. But I think one must bear in mind that our specialities are quite involved. It's a 4-year training program.
Yes, yes.
So it's in addition to our dental degree.
Oh, wow.
So when you are consulting with dentists or dental personnel, I think you should actually check it out to make sure that you are consulting with an appropriately qualified person.
Okay.
So that you don't have
Yes.
you know, dissatisfied patients. Yeah,
That's
and
correct.
comebacks.
That's correct. Our program of discussion here this evening, we're discussing orthodontic treatments with the specialist live in studio. She's an IMA member and she's an orthodontist. And we're discussing orthodontic treatments here this evening. Please make use of the telephone lines 021-696-0109 and anything relating to orthodontic treatments. We are here, the specialist is here to basically uplift and inform us regarding her speciality, which is the orthodontist. What exactly do they do? Doctor, maybe you can just, we know in terms of, you know, aligning your teeth and aligning the jaw and stuff like that. An example of severe problems of alignment, do we actually get that and can that be fixed?
Yes, we do get severe problems.
Okay.
The first slide that came up was a severe problem.
Okay.
When it's severe, and it looks like the first slide that we saw,
Right.
then extractions are necessary. We need to take out teeth.
Okay.
And because, you know, you need to put those teeth somewhere, and it's obvious that the jaw's too small for all those teeth. And it's necessary to take out teeth. Now, when we take out teeth, we do it in a planned fashion too.
Okay.
You have to plan which teeth to take out so that you can rearrange them,
Right.
so that they're functionally optimum,
Yes.
and also aesthetically they look good.
Yes,
so there's
yes.
certain teeth we will not take out. If you have an eye tooth that's, you know, sticking up on just below your lip, like the
Right.
children will say fangs,
Fangs.
we don't take those teeth out because
Okay.
those are part of our smiley teeth.
Yes, yes.
There's just one canine
Yes.
in each quarter of our mouth. So, you know, it has to be planned.
Yes, yes.
So severe cases, yes, can be treated. Sometimes they take longer. If I just take an example of a very severe case, it would be a case where you have patients who have cleft lip or palate.
Right.
And because of where the cleft site is, you would have disruption of the way the teeth are formed, and also the way the teeth come through, in addition to the fact that the jaw is smaller because of that cleft site.
Okay.
So those are some of our challenging cases.
Yes.
Yes, they are treatable.
Okay, that's
but
great.
challenging.
That's
often.
very good. That's very
Yeah,
good to
yeah.
hear. And Doctor, I'm also aware, but you will talk to us, inshallah, a little bit more about that. There's also something called the ugly duckling stage, and I think that can be very, very emotional also to the little ones going into that stage. But inshallah, Professor Amenah Shaikh will basically talk to us a little bit more about that stage, because it's affecting so many little ones. But that we will discuss inshallah after the break. The lines are still open, 021-696-0109. But call us, we'll be back shortly inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and welcome to the last segment of tonight's program. We're discussing orthodontic treatment with Professor Amenah Shaikh. She's an orthodontist. The lines are still open, 021-696-0109. Please make use of that and just ask us any questions relating to our topic of discussion. Professor Amenah, she's a specialist. She's an orthodontist. Doctor, before our break, you know, we mentioned about the ugly duckling stage, and I know that is called the mixed dentition stage. Talk to us a little bit about that stage, and what age can we expect that stage?
Okay, that is going back to the middle stage that we spoke
correct.
about earlier, between the age of 7 and 9.
Right.
That's when the top teeth are coming through and the bottom teeth are coming through, the front teeth.
Right.
Now, typically, you can imagine it's an adult.
There you go.
It's adult teeth that are coming through in a little mouth and a little face.
Right.
So, and we call it the ugly duckling stage because this is the time when parents are more concerned than the children.
Yes.
That look at the child's teeth. If you look at the picture of the teeth there, you'll see that the center teeth look like they have a gap.
Right.
They also look splayed. The teeth adjacent to them look like they're coming through skew. And often you'll also find that the patient has a large overbite.
Right.
And that is all related to growth as well. Remember, this is a little person with adult teeth.
Okay.
At the same time, you have some baby teeth in the mouth and you have some permanent teeth in the mouth. Now, if you look at that diagrammatic illustration on the right-hand side, you'll see the first on the left, top left, you see the 4 front teeth and you see a gap in between. Now, if we look at what's happening underneath, you'll see that's the slide next to it. The picture next to it, you'll see the canines up at the top in the bone. The yellow is the bone, and you see that they're coming down. Now remember, that's the permanent canines. As they come down, they hit up against the roots of the lateral teeth there.
Yes.
And as they hit up against the root, those lateral incisors splay, and you can see those arrows illustrating that. That is normal. So what you see in the mouth, you see that picture in the mouth.
Right.
The gap between the teeth, the splaying of the lateral incisors, but as the permanent canines come through, they push everything together again.
Right.
And remember, the gaps are needed because the permanent teeth are bigger than the baby teeth.
Right. Yes.
So you can see that everything falls into place eventually.
Yes, eventually.
Now, often parents will come and say, please have a look at my child. The teeth, they describe it as a Bugs Bunny look.
Okay.
And then they're concerned that there's braces needed.
Right.
It's become so common and
Yes.
it's so accessible that parents think that every child should go through braces.
So
and
every
it's
child should not go through braces.
not
Is that
necessarily.
okay?
Not necessarily.
Yes.
And the way I would explain it is precisely as I did it. If you
Right.
show the parent the X-ray, the radiograph,
Yeah.
and demonstrate to them what is happening,
Yes.
then everybody's minds are set at ease.
Okay.
And for the child, if they're affected psychologically, make them aware of their peers and
Yes.
have them look around in the class and say, but everybody looks like you.
Shame. Because you explained so beautiful. It's adult teeth in a little face, a little mouth.
Yes, yes, that's right.
So
So,
it's-
I mean, it's going to look phony.
It's going to look very,
It's going to look odd,
Yes,
but at the
yes.
same time, all the children in that age group look the
looks
same.
exactly the same. So really, to all our parents, we should not really worry. I think that's the process, and it's part of growing up, and we must basically just convince our kiddies, our little ones. That's part of it, and they're still very beautiful and pretty, mashallah.
Absolutely.
Doctor, in terms of what are we supposed to look out at that stage still? I've noticed thumb sucking is also very, very common. Can that affect the growth of the teeth?
Yes, it can affect the position of the teeth, and it can also affect the top jaw.
Okay.
It depends largely on how often it's done and how
Yes.
vigorously it's done.
Okay.
When a child has the habit of sucking the thumb, where you just continuously see the
There you
thumb
go.
in the mouth, you'll find that because of the pressure, the sucking pressure of that thumb with the cheeks against the teeth at the back,
Yeah.
the teeth at the back are going to push closer, and they're going to come up against the palate. So the palate is going to be shaped high because of that thumb.
Yeah.
The front teeth, the top teeth are going to be pushed out.
Yes.
And if there's pressure of the thumb on the bottom teeth, those bottom teeth are going to push backwards.
Right.
So that is all related to the amount of sucking that happens and how vigorously they suck. So yes, especially in the permanent teeth, we need to be concerned.
Yeah.
If you're seeing your child with baby teeth still sucking the thumb, you start discouraging that habit so that when the permanent teeth come through, you don't have this problem.
Okay. But doctor, you're going to basically give us tips how to discourage the little one, inshallah.
We'll try.
Inshallah.
We'll
There's a
try.
call on the line. Let us go straight to the lines. Assalamu alaikum and welcome to the program.
Wa alaikum salam.
Wa alaikum salam, my dear. Please pose your question. Doctor is listening.
Okay. I was advised by my dentist, my daughter is 7 years old. She's experiencing pain at the back of her jaw. I was advised by our dentist that she did an X-ray, and I was advised that her molars are coming up. Teeth which are supposed to be emerging at around 11, 12 are emerging now. Should I be worried?
No, if they're emerging, what it means is that the teeth are coming through. Just remember that
she's
your
actually got pain, and she's got a flap of skin that is loose. It's almost, if I can describe it, it's almost a cut in the mouth, but in the gum.
Yes, no, I know exactly what you're describing. Just remember that not only do the front teeth come through at that age, the first molars are also coming through at that age.
Oh,
and,
okay.
and it's probably her first molars coming through. Now that what you have described is actually the gum that is covering the part of the tooth. It becomes painful when it gets inflamed.
Very painful. I've experienced her having a lot of pain.
It's probably inflamed, and the way to deal with it is, if the tooth hasn't come through completely, to keep that area clean. If you need professional help, you may want to take her to the dentist. Maybe they can numb it and then clean it professionally.
Yeah, I'm trying to avoid excessive use of antibiotics as well in the event of an infection. So
Okay, so you need to keep that area clean, brushing and keeping that area clean. Also, at the same time, what you can do, if she's able to gargle, you can take some warm salt water rinses and let her rinse as frequently as possible. The whole idea is to keep that area clean.
Okay.
Remember, because it's a flap, food is going to accumulate, plaque is going to accumulate.
yes, we don't want obviously food particles and all of that to be getting into it.
Precisely. So you need to keep the area clean.
What worries me is this: will this affect now the setting of her teeth, like you mentioned about the adult teeth in the little person's face?
Not necessarily, no. I don't think you should be concerned. It's like teething. She's getting her permanent teeth.
Oh, so it's a teething pain.
It's a teething pain, yes. But just check out for the inflammation. That flap can easily be inflamed because the food can accumulate. So keep the area clean.
Okay.
All
And,
right.
and if we need to take her to go and look at braces at any time, when should we be doing it?
Okay, as the permanent teeth start coming through, at this stage what you should be looking out for is to make sure that the top teeth, as they come through, the front teeth I'm referring to, are overlapping the bottom teeth.
Okay.
If the
So
top
she's got to have a slight overbite.
That's right.
Okay. Okay.
Okay, and then you're going to start watching as she sheds her baby molars.
Yeah.
Then you're going to start seeing if they're coming through in place. But you're obviously going for your regular checkups to the dentist.
Yes,
and
we are.
usually the dentist will guide you.
I'm quite good about that. I try to be quite good about it.
Wonderful.
Jazakallah.
Wonderful.
Oh, that's fantastic.
Afwan.
Shukran so much to that caller for that very interesting question, and all the best to your children, inshallah. The lines are still open, 0216960109. We're discussing orthodontic treatment with the orthodontist live in studio, and you're most welcome to be still part of this program. We still have about a few minutes left, about 4 minutes left, inshallah, to this program. So please make use of it for any advice that you need regarding orthodontic treatment with Doctor. Doctor, before we took the caller, we saw the thumb sucking, and you know what it can basically cause and do to the gum and the jaw. We need some tips how to discourage. You won't believe it. In the week, I saw a teenage daughter. She was about 16 years old with her mother, and she was thumb sucking.
By the time it reaches that stage,
Yes.
it becomes extremely hard to discourage.
Yes.
At that stage, they must want to leave the habit.
Okay.
We usually start by just discouraging, reminding the child that, you know, take
Yes.
your thumb out of your mouth.
Yeah.
Sometimes you have to resort to putting things on the nails, on the hand,
Yeah.
to discourage or remind them that there's something there.
Yeah.
We use little things like put a elastoplast around the thumb, so
Okay.
it's a reminder for them.
Yeah.
If that doesn't happen, sometimes we make plates
Okay.
that are fitted in the mouth. So when you place a plate,
Yeah.
you're actually taking away that satisfaction they get with the thumb against the palate. Some
Okay.
people would even put in little spurs on the plate.
Okay.
You know,
Right.
things shutting out of the plate so
Yes.
that the thumb is prevented from going through.
Yes.
Hopefully we don't get to that stage,
yes.
because we don't want to put nasty things in the mouth either. So you start off early. That's why I said earlier on that when your child, you see in the, you know, when they still have their baby teeth and the habit is not going away by the age of 3, 4, you have to really vigorously discourage.
Okay. Shukran so much, Doctor. Doctor, there's a caller. Let us go straight to the lines. Hello, good evening, and assalamu alaikum. Assalamu alaikum.
Wa alaikum salam.
Wa alaikum salam, my dear. Please, you can pose your question. You can pose your question to the doctor.
Wa alaikum salam. Gee, doctor, I just want to I just want to ask the doctor, and an elderly person here, I've got some dentures to wear. Hello, yes.
We can hear you, but you need to lower the volume of your television, please, because we're getting some feedback. We're just waiting on that caller. to lower the volume of her television, inshallah. Hello, are you back? Hello?
Hello, can you hear me now?
Much better. Jazakallah so much. Please pose your question.
I just wanted to find out from the doctor, as an elderly person, which I've got dentures to wear, but I can't wear these dentures because, you know, they're pressing my gums very badly. It's very, very painful. Is there something else in the dentures, is something the doctors can make as orthodontists, a soft way, like put it onto the gum, not to pain?
Yes, yeah.
I'll hear on the TV, right?
Walaikum salam wa rahmatullahi wa barakatuh.
Okay, I think what the listener needs to do is to have the denture assessed. It could be various reasons why that could happen. It could be because it's an old denture and it doesn't fit properly. My advice to you would be to go back to your dentist, and I'm sure they'll be able to assist you so that you're more comfortable.
Shukran. Doctor, we have a few seconds for you to wrap up, inshallah. Some good advice from your side as an orthodontist to all our viewers.
I think fundamentally, just remember that we can only move teeth if they're healthy. If you start implementing good oral hygiene practices, like you said in the beginning, with your tarbiyah, I must compliment you for that. If we follow those practices, you'll have healthy teeth, and then we can fix them. We can actually put them in the right place.
Oh, alhamdulillah. Professor Amenah Shaikh, jazakallah so much for being here. Really, really interesting program, alhamdulillah. And shukran so much to all our viewers for participating in tonight's program. Well, next week, inshallah, always give a little tease, you know, to all our wonderful viewers. Next week, we'll be having travel medicine with Dr. Salim Parker, because we know it's that time of the year when many of us is going to take that well-deserved break. But inshallah, shukran for participating once again. From myself, Najwa Mohammed Luddy, and my wonderful, interesting guest, Professor Amenah Shaikh, we want to wish you a beautiful week ahead. Fi amanillah, wassalamu alaikum wa rahmatullahi ta'ala wa barakatuh.